complicated and complex thing to try to explain. And it is really a move away from the traditional way that NHS, social care and voluntary sector have worked together into one that is much more about collaborative working and what we've traditionally had, which is a hospital-based, what you might call a medical model, into something that's much more a blend of social care and medical care coming together to become a cohesive system. As we know at the moment, the system is really fragmented and that just isn't good enough anymore. You know, hospitals used to be full of people who may have had a heart attack or had a hip replacement. They've been in for a number of weeks following those kind of things. Now they're in for a much shorter period of time. And actually what has happened, particularly over the last 5 years, is those disease profiles have changed enormously. And, you know, today in the hospital there's lots of people who they don't have anything particularly wrong with them that they need 24/7 medical care or nursing care, but they need some kind of care. That's a big change we've seen, particularly over the last 5 years. And so at the end of the day, being in a hospital isn't the right place for those people to be. From my perspective, we've got to change the whole system, and it's under this 5-year forward view that you may have heard of, which is really changing the emphasis into to meeting something called the triple aim. So that's about doing 3 things all at once. So we need to, you know, deliver better health and well-being for people, and that is really about, you know, community assets, working with people in the place they're at, working with people in a way that is meaningful to them at home or as close to home as possible. It's also about, we've got to deliver better quality care, and there's much more nowadays than a medical intervention or a nursing intervention. It is around that holistic care around the whole family. And then the third thing, we've got to do it all within the financial resource envelope. And individual organisations can't do that on their own, so therefore we've got to work really closely and really collegiately and actually stopping failure. And, you know, it's this delivering care upstream, as it were, so moving more into prevention and helping people be well at home. So that is really where people like the voluntary sector can come in, and I think it's great that the voluntary sector really wants them to be part of this new system, this new approach. What we're doing across the system is we've got a governance structure around it, and certainly the local system here, if I talk about Airedale, Water, Craven, Clinical Commissioning Group, firmly wedded to delivering an accountable care system where we all work together and everybody's contribution has equal value. And I think that's another really important point, that it's not a hierarchy anymore. This is about equal value. One of the main reasons I think it's important for us to work together, so round that table, you know, the collaborative leadership table, if you like, with the voluntary sector, GPs, care trusts, you know, acute trust and social care around that table, is that diversity of view to make sure we make the right decisions. And actually each of us in our own silos view the world differently through different lenses, and my, you know, strong view is you need to be able to gather all those different views together, collectively understand each other's views, but actually our decision making should be based on the diversity of those views. So that's another big benefit of an accountable care system, is really that collective worldview on what is the best thing. It's really important for us to make the right decisions, because this is about the next 5 to 10 years after all, and I don't think any of us can make the right decisions in isolation. So hopefully we can make the best use of that scarce resource that we've got available to us to do the best job for the people we're here for. That we're there to work through together how we can work differently together, using new models of care, different ways of working, to achieve that triple aim. So back to health and well-being, better quality care, and within the financial envelope that we've all got. And for me, that is it's a big change from organisational silos, as I've talked about before, and actually, you know, places like here not really having a concern for what happened to the person before they come in or what happens after they go home. So that's a really important thing now, that we do have a concern for actually what happens when a person comes in and how you can contribute to either preventing that escalation of care, or when people are ready to go home. I'm talking about 40% of people in our beds are actually what you call medically fit for discharge, but they need something else, they need additional care, something else in the community. They may not be ready to go home, and in the past they may have ended up in long-term care, and that's not right for that person, and it's not right for the system either, that people are ending up in nursing homes when maybe they could have a fulfilling life at home. So that's an area that we're looking at really closely, and there's no way we can do that as a system without the input of all the people who sit around that table, voluntary sector included, having, I think, a fairly major contribution to that, because people in the voluntary sector know a lot more about some of our parts of the community that don't get heard, some of the parts of the community that are particularly vulnerable. There's a lot around drug and alcohol problems, there's a lot about loneliness, there's a lot about support for carers. Often people have got physical problems, but actually they're driven because of lack of social resilience. So you get people pitching up, and it's really fear, loneliness and other things that they're pitching up in, say, A&E, and being able to develop a system and an approach where we can tackle that at source as far as we can has to be much better. I guess if I was to just conclude, it is around working together differently, mindset change. There's lots of stuff we have to do to enable that, use of technology, a different workforce, different ways of thinking about how we navigate through and work together to get the best that we can really for the populations that we're here to serve.